Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Empyema is a serious infection that requires immediate medical attention. It affects the space between the lungs and the inner chest wall, known as the pleural space. This pleural space is a thin gap that normally contains a small amount of lubricating fluid. This fluid is essential as it helps the lungs move smoothly and effortlessly when you breathe in and out. Without this fluid, the lungs would struggle to expand and contract properly, making breathing difficult. In empyema, however, this space becomes filled with pus, a thick fluid that results from infection. The accumulation of pus makes it extremely hard to breathe and can cause severe chest pain. Empyema is a serious condition that can lead to further complications if not treated promptly. It needs prompt medical attention to prevent the infection from spreading and causing more damage. Early diagnosis and treatment, including antibiotics and sometimes surgery, are crucial for a full recovery and to avoid long-term health issues. Empyema usually starts with an infection in the lungs. Pneumonia is the most common cause. Bacteria, viruses, or fungi can cause these infections. The infection causes inflammation and fluid buildup in the pleural space. Other causes include chest injuries, lung diseases, and complications from surgery. These conditions can also lead to fluid buildup and increase the risk of infection. Early recognition of empyema symptoms is vital. It helps in seeking timely medical help. Common symptoms include chest pain, often sharp and worse with breathing. Fever and chills are also frequent indicators. Shortness of breath is another telltale sign. As the condition progresses, coughing, fatigue, and weight loss may occur. If you experience any of these symptoms, it's crucial to consult a doctor immediately. Delaying treatment can lead to complications. Section 4. Diagnosing empyema, unveiling the culprit. Empyema is a condition where pus accumulates in the pleural space, the area between the lungs and the chest wall. This can lead to severe respiratory issues and requires prompt medical attention. Diagnosing empyema involves a combination of physical examination and medical tests. The process starts with a thorough physical examination where doctors look for signs of infection and respiratory distress. Doctors listen to the lungs with a stethoscope for any abnormal sounds. These sounds can include crackles or decreased breath sounds, which may indicate fluid accumulation. Chest X-rays are usually the first step in imaging. They provide a quick and non-invasive way to visualize the lungs and detect any abnormalities. They can reveal fluid buildup in the pleural space, which is a hallmark of empyema. The presence of fluid can be a critical indicator that further investigation is needed. A CT scan provides a more detailed view of the lungs and pleural space. This imaging technique offers a clearer picture, helping doctors to assess the extent of the infection and plan the appropriate treatment. To confirm the diagnosis, doctors may extract a sample of the pleural fluid. This procedure is essential for identifying the specific type of infection and determining the best course of action. This is done through a procedure called thoracentesis. During thoracentesis, a needle is carefully inserted into the pleural space to withdraw fluid for analysis. Lab analysis of the fluid confirms the presence of infection. The results from the lab help doctors to identify the causative organisms and tailor the treatment to effectively combat the infection. Section 5. Preventing empyema, a stitch in time. Preventing empyema primarily focuses on reducing the risk of lung infections. Getting vaccinated against pneumonia and influenza is crucial. Practicing good hygiene like frequent hand washing can also minimize the risk of infections. Managing existing lung conditions such as asthma or COPD is essential. If you have any respiratory symptoms, seek medical attention promptly. Early treatment of infections can prevent their progression to empyema. Section 6. Treatment options, a path to recovery. In this section, we will explore the various methods and strategies used to treat empyema effectively. Treating empyema usually involves a multi-pronged approach, combining medication, procedures, and sometimes surgery to ensure the best possible outcome for the patient. Antibiotics are the cornerstone of treatment. These powerful medications are essential in fighting off the bacterial infection that causes empyema. They target the bacteria causing the infection, helping to reduce the spread and severity of the disease. Draining the pus from the pleural space is crucial. This procedure helps to relieve pressure on the lungs and allows for better breathing. This is often done through a procedure called a chest tube insertion, where a tube is placed in the chest to continuously drain the infected fluid. In some cases, surgery may be necessary to remove infected tissue. This is typically considered when other treatments are not sufficient. The recovery period for empyema varies depending on the severity of the infection and the overall health of the patient. Close monitoring and follow-up care are essential. Following medical advice and completing the full course of treatment is vital for a successful recovery. Patients are encouraged to adhere strictly to their prescribed medication regimen and attend all follow-up appointments to ensure the infection is fully resolved. WMCC, your ultimate medical consultant connectors.